The last chapter about addiction, anyway. From now on, we'll be talking about other things. But this is a lot. This one covers just about everything. As you can see, there's 174 slides. So this is going to take a while. I'll try to keep my voice while I'm doing this. Other addictions and other drugs. We're going to talk about like everything in this. Inhalants. Inhalants are volatile liquids, aerosol sprays, gases that come in pressurized tanks. These substances have many of the same psychoactive effects of street drugs. Sports drugs are natural and synthetic substances. They accelerate the healing of injuries. They increase performance. They alter the state of the athlete's consciousness. Hard to classify drugs. They are drugs such as animal extracts, herbal preparations, smart drugs and drinks, and nootropics. They've been used for their psychoactive effects. They've been used to improve mental health. They've been used to improve physical health. Inhalants are used because the user finds it stupefying, they find it intoxicating, and occasionally they find it psychedelic, but usually it's the stupefying and intoxicating aspect that they're seeking. There are three main groups of inhalants, the volatile solvents and aerosols, the volatile nitrites, and anesthetics. I came across inhalants a lot when I was working in the emergency room in Omaha, and in Oklahoma. This was very common back in the 80s and 90s. Most of the volatile solvents and aerosols are synthesized from petroleum and mixed with other chemicals. Hydrocarbons are found in glues, gasoline, and nail polish remover. Many aerosols are inhaled for their propellants rather than their ascribed contents. Other volatile organic compounds include esters, ketones, alcohols, and glycols. And all of these are carcinogenic, by the way, including the alcohols, especially the ketones. We used to use ketone when I was in the service to clean things, and then they discovered that it was carcinogenic, and about 10 years later they started keeping us from using ketones to clean things. The volatile nitrites include butyl and amyl nitrite. These drugs are used as vasodilators for people with heart problems. They have also been used in air fresheners. Illicitly, they are used recreationally at parties, but especially in sexual situations. And I will explain that in just a moment. Anesthetics are used to block pain or induce unconsciousness for medical procedures. Nitrous oxide is used in dentistry for anxious patients who do not wish to use Novocaine. Also called laughing gas, it is not uncommonly used at parties to induce giddiness and euphoria. And it really doesn't make you it doesn't make you laugh that much, I guess. The most widely used inhalants are nitrous oxide, nitrites, gasoline, glue, spray paint, aerosol sprays, lacquer thinner, and correction fluid. And the whiteout is the correction fluid. Once upon a time, you used to be able to buy a case of this stuff. Now, nope, can't do it anymore. They only allow you to have one bottle at a time. Inhalants are sought because they are quick acting with intense effects. They enter the bloodstream within 7 to 10 seconds, and they may last from a few minutes to an hour. They are cheap, readily available, and widespread. There are more than 1,500 chemical products that can be inhaled for their psychoactive effects. They are readily accessible to children and adolescents, as many exist in any garage or home. They have more direct toxic effects on body tissue. There is a lack of awareness of inhalants as a drug problem. So some people will start using them. They'll be in a closed room and they'll spray something, and all of a sudden they'll get just a little bit high. So they start using it on purpose. Inhalant abuse is most prevalent among adolescents. Inhalants account for from 700 to 1,200 deaths in the United States per year. This worldwide problem, as cheap highs are sought by the young, the poor, street children, recent migrants to cities, indigenous peoples, and children of parents who work at home with volatile chemicals. The inhalant of choice in many poor countries is gasoline because of its availability. Inhalants are most likely abused by 12 to 17-year-olds and more females than males. This problem was especially serious in the 1990s, but has since dissipated. American Indian and white adolescents are more likely to use inhalants than blacks or Asian Americans. There are 7 methods of using. You can sniff it, breathe in the inhalant through the nose directly from the container. You can huff it, soak material and put the material over the mouth and nose. This is known as huffing. You can bag it. That's where you soak the material and place the material in a bag to be inhaled through the nose or mouth. You can spray it, spraying the inhalant directly into the nose or the mouth. Balloons and crackers, puncturing a can of inhalant and capturing it in a balloon for inhaling. Masking, spraying an aerosol in a bag and then putting the bag over your head. And you can spray it on your clothing. Volatile solvents are carbon and hydrocarbon-based compounds that turn to gas at room temperature. These are things such as gasoline additives, paints, especially metallic paints, kerosene, air dusters, paint thinners, lacquers, nail polish remover, spot removers, glues, and plastic cements, and lighter fluid. In the old days, the plastic cement, the glue that you used to put models together was different than it is today. They found a lot of people putting models together because they were getting high off of the glue. So they changed it. They changed it to a citrus formula. So now if you put a model together and you buy airplane glue or whatever, it probably smells like a lemon rind, or it smells like an orange rind, or it smells like grapefruit. Probably grapefruit. That's because they make it out of citrus now. And it's not nearly as intoxicating as it was once upon a time when I was a kid. And I don't really remember using glue and getting stoned on it, but evidently the glue was fairly strong. Volatile solvents are absorbed very rapidly into the blood and move to the heart, brain, and liver within 7 to 10 seconds. Temporary stimulation, it gives you temporary stimulation. It elevates your mood. It reduces your inhibitions. It makes you impulsive. It excites you, makes you irritable, makes you dizzy. It slurs your speech and gives you an unsteady gait, and it makes you drowsy. These inhalants are exhaled by the lungs and excreted by the kidneys. Kind of dangerous. Let's not get our organs involved. But unfortunately, of course, they do in order to get rid of this substance. After prolonged inhalation, the user may experience delirium with confusion, psychomotor clumsiness, emotional instability, impaired thinking, and maybe even coma. Long-term effects of inhalant use. This is not good news. Just so that you can get high. Sometimes if you use it too much, this is what happens. Arrhythmias and myocarditis. Myocarditis is the enlargement of your heart muscle. Pulmonary hypertension, respiratory distress, and lowered breathing capacity. Liver toxicity. Carboxyhemoglobin may cause brain damage. Now remember, carbon monoxide has a 27 stronger affinity for hemoglobin than does oxygen. Now the problem is, of course, if you're replacing your oxygen with something else, then you're not getting any oxygen into your brain. And of course, if it's carboxyhemoglobin, the carbon and oxygen mixture it will, you also aren't getting oxygen into your brain, and it can cause a lot of problems. Potentially it could kill you. Usually you're not in a closed room with you're not using it that much to actually kill yourself, but you can go into a coma. It can cause brain damage. Some inhalants may cause neonatal growth retardation, odd facial features, and tremors in newborns if it is used by a pregnant woman. While most huffers move on to other drugs, those who stay with inhalants can expect some fairly debilitating effects. Poor coordination characteristics, inability to concentrate, weakness, disorientation, weight loss, memory loss due to hippocampal interference, poor problem solving, difficulty controlling one's behavior, blood irregularities, and chromosomal damage. So you're not only killing yourself, you're also destroying your future offspring if you ever reproduce. Chronic huffers tend to have antisocial personality disorder, but it is not sure whether the huffing causes the behavior or the environment. These individuals also tend to use whatever drugs they come across. The most widely abused substance is toluene methylbenzene. It's actually also known as methylbenzene because it is such a good accelerant and is in so many products. It's in glues, drying agents, solvents, thinners, paints, inks, and cleaning agents. 65% of all the chronic abusers of toluene have neurological damage. This is a permanent situation. So what you are doing is that you are destroying your neurons, neurons in your especially in your brain, but especially in your cerebellum, where it gives you poor coordination. I'm not sure why I put that in there. Toluene and benzene, the huffer's high. Trichloroethylene, TCE, is another common solvent found in substances used for huffing. One of the things I need you to know is the most common inhalant is toluene, and the one that kills the most people, gasoline, strangely enough, is gasoline because it is a hydrocarbon and it does so much damage to your lungs and to your brain. Trichloroethylene is in correction fluid, paints, metal degreasers, spot removers, extracting oils and fats from vegetables. It causes depression and moderate hallucinations. If used heavily, it can cause neuropathy. Some of these neuropathies can be permanent, and of course, that's something that you don't want. Nhexane and methylbutylketone, also known as MBK, are solvents used for glues, solvents used for adhesives, diluents for plastics, diluents for rubber, in the production of laminated products, as a paint thinner, and as a solvent for dyes. Nhexane and MBK have been shown to cause neurological damage, especially in the brain. Recovery can take up to 3 years. Small molecule alkanes are gaseous at room temperature and cause cardiac arrhythmias and sudden death, and include methane, ethane, butane, and propane. When we were up in Montana, there's a religious sect up there called the Huterites. And the Huterites are famous for, they have colonies, kind of like the Amish and everybody else. Anyway, each colony will specialize in something. The one in Harlem specialized in chicken, and the one on the other side of Havre specialized in pork. So they would trade their meats back and forth. The one would raise chickens, and they trade their chickens for the pork, and the ones that raised pork would, of course, trade their pigs for the chickens. One day on the pig farm, what they were doing, they had a cement container, and it was a well, kind of a well. And so what they would do, they would scrape the pig manure down into this well. And then at some point, they would use it as fertilizer. Um, so the one day this guy was doing this, and he fell into the pit. The pit was about 8 feet deep. His wife, seeing that he fell into the pit, reached down to grab his hand. Of course, he wasn't reaching up at the time, and both of them died. They both died of methane poisoning because of the methane in the pit. Methane is kind of is like propane. Methane and propane are heavier than air, so they go to the bottom of things. And that's what had happened with this pig manure. It had created so much methane that he was dead before he hit the manure, because the methane had replaced all of his. He had had an almost instant heart attack and he had died. And his wife, when she leaned over into the pit, she was breathing methane at the same time, and she died as well. Large molecule alkanes are also neurotoxic and include hexane and pentane. Gasoline is readily available and used as an inhalant, especially on American Indian reservations. The effect only lasts for 3 to 5 minutes. This is very common in South Dakota, North Dakota, Montana, Idaho, and Washington. Not only are the hydrocarbons neurotoxic, but the solvents, metals, and additives can cause problems as well. It can cause insomnia, tremors, anorexia, paralysis, and lead poisoning. Lead poisoning can cause damage to the brain, the liver, bone marrow, kidneys, and lungs. Residual effects might last for 5 to 6 hours. Over half of all inhalant deaths are due to gasoline inhaling, as I said before. So toluene is the most common inhalant, but gasoline is the one that kills the most people. Over half of inhalant deaths are due to gasoline inhalants. Alcohols are the most frequently abused inhalant solvents: methanol, ethanol, and isopropanol. When inhaled, alcohols can produce a mild high, along with nausea, vertigo, weakness, vomiting, headaches, abdominal cramping. Seems kind of stupid. What they're actually after isn't the nausea, the weakness, the vomiting, headaches, and abdominal cramping. What they're after is the vertigo. That makes them feel great. For ER personnel, it is important to know the warning signs of solvent abuse: headaches, chemical odor on the body or clothes. And I'll tell you what, there's having dealt with hundreds of these cases, I can tell you it doesn't really matter what you're inhaling. It's all over you. It's all over your clothes, especially your shirt. Anything close. And the interesting thing is, you see this kid with the hoodie on. Back before hoodies were really popular, we used to find the kids would come in and there'd be all kinds of crazy stuff wrong with them. But the ones that were using inhalants always had their hoods up. They always had their hoods up and they had it pulled down over their faces because it's easier to inhale if you're trapping all the gases. So all we'd have to do is pull their hood back, and you could you could smell it. It was fairly easy to smell. Anyway, okay. Headaches, chemical odor on the body or clothes, red, glassy, or watery eyes with dilated pupils, nosebleeds, inflamed nose, rashes around the nose or mouth, and sometimes these can cause blisters. It looks like acne, but it's only just around the mouth. Slow, thick, or slurred speech, staggering gait, disorientation, lack of coordination, pains in the chest and stomach, fatigue, nausea, shortness of breath, loss of appetite, intoxication, irritability and aggression, seizure or coma. The seizures and it's the chest pains. They think they're having a heart attack, and that's the reason they come in. And if they go into seizures, of course, then their friends will bring them in. but usually they're not in a coma. We didn't really have that many people in comas when I was in Omaha and Oklahoma. Volatile nitrites. Nitrites have been used as medicines, especially heart stimulators, for angina. Angina just means chest pain. Um, actually, it means pain. Angina pectoris is chest pain. Since the 19th century, we've been using nitrites, alkyl nitrite, isomyl nitrite, butyl nitrite, isobutyl nitrite, isopropyl nitrite, and cyclohexyl nitrite. Nitrites dilate dilate blood vessels so that organs can receive more blood. This is usually done for the heart during angina attacks or with cyanide poisoning. It takes 7 to 10 seconds for the effects to take place and lasts for about 60 to 70 seconds. The blood pressure lowers and hits its apogee at 30 seconds and returns to normal at 90 seconds. But by that time, the pain has gone away. And usually, one of the things that's causing the pain is the fact that you're all tightened up because of the pain. So what we use the nitrites for is we want you to relax. And so in order to take the pain away, we use the nitrite. The nitrite relaxes you, and hopefully that makes it go away. If it doesn't, of course, we hit you again with the nitrites. Sometimes these nitrites are called poppers. It lowers your blood pressure, and that's what we're trying to do. We're also trying to relax your muscles, and that usually makes the pain go away. Nitrites can cause a feeling of fullness in the head. It gives you a rush. It gives you a mild euphoria, makes you dizzy, makes you giddy. As the inhalant burns off, they might experience headache, nausea, vomiting, and chills, depending on what is going on before we hit them with the nitrites. Excessive abuse may cause oxygen deprivation, fainting, or passing out, temporary asphyxiation. Overdoses do occur and necessitate taking the victim away from the nitrite. That's the best thing that you could do, is take them away from the nitrite. CPR might be necessary to maintain heart rhythm and respiration. Chronic users will have a reduced oxygen carrying capacity due to methemoglobinemia. Nitrates are used to enhance. Okay, so I told you why we used them, nitrites, to stop angina for people that were having heart attacks. But you can play with them as well, and this is the reason that people use them. Nitrites are used to enhance sexual activity by increasing blood flow to sexual parts and relaxation of smooth muscles. Okay, so where do you have smooth muscles? You have some smooth muscles in your heart, and you also have smooth muscles in your digestive tract, especially in your anal sphincter. Okay, so we're relaxing your smooth muscles. That means your heart's going to slow down, and your anal sphincter is going to open up. This is especially necessary when the anal sphincter requires relaxation during anal intercourse. Unfortunately, nitrites impair the immune system by inhibiting the functioning of white cells. Nitrites also convert to nitrosamines, which are cancer-causing chemicals. So people use it for anal intercourse. Now, the problem is if you use it too frequently. Excessive abuse, you get oxygen deprivation, you faint, and maybe you asphyxiate yourself. And this is one of the reasons why you might have to give somebody CPR. Seems kind of strange to me. Poppers, when used with Viagra, cause lowered blood pressure in users since both medications lower your blood pressure. When these two drugs are used with methamphetamine, people have been known to faint or even die. Volatile nitrite abusers are notorious for multiple drug use. 2/3 use at least 3 other inhalants. 1/3 abuse alcohol. 1/3 abuse drugs other than inhalants. Now remember, alcohol is a depressant. So if you're using a depressant and you're using an inhalant, you're using a popper, and you're taking Viagra at the same time, that's 3 different things that lower your blood pressure, and this is not good. What else lowers your blood pressure? Marijuana does. So you've got to be really smart about how you're using all these things. Anesthetics are used to slow the central nervous system and stop pain from reaching the brain. Anesthetics also cause euphoric effects when abused. One of the first anesthetics to be abused was, of course, nitrous oxide. Recently, nitrous oxide has been abused along with ecstasy to accelerate the rush and to enhance the effects. Nitrous oxide is sold in small plastic canisters to be used in cooking. And there you go. That's what they look like. Nitrous oxide. Nitrous oxide's effects include dizziness, giddiness, and disorientation, silly laughter, buzzing and throbbing in the ears, visual hallucinations, confusion and headache, feeling that one is about to pass out, impaired motor skills and fainting. The effects only last for about 2 to 3 minutes. Cognitive functioning is impaired with the drug, but returns to normal after about 5 minutes. This is my favorite cartoon. There you go, he's using nitrous oxide. There you go. Long-term exposure can cause peripheral and central nerve cell damage due to a lack of oxygen. Nitrous oxygen replaces oxygen in the blood. Long-term exposure will lead to loss of balance, loss of dexterity, overall weakness, numbness in the arms and legs, cardiac arrhythmias, asphyxia, seizures, and eventually death. Halothane is rarely used in the West. It is widely used in third world countries because it is inexpensive and works very rapidly. This anesthetic is used primarily in veterinary procedures. It is most frequently abused by hospital personnel. Inhalants cause less physical and psychological dependence than other depressants. Inhalants cause cognitive impairments that hinder comprehension and recovery. Inhalants will sometimes cause a cross-tolerance to other depressants, especially alcohol, if used chronically. Inhalants are seen as low class among the drug-using community, and there you go. 3 categories of drugs are used in sports. Therapeutic drugs used for specific medical problems and administered through proper medical supervision, such as analgesics, muscle relaxants, anti-inflammatories, and asthma medication. Ergogenic drugs, performance-enhancing drugs, would be steroids, human growth hormone, blood doping, and stimulants. And then recreational and mood-altering drugs are also used in sports. Athletes use drugs because they perceive drugs as a quick way to put on pounds of muscle, to increase stamina, to get up for a game, to relieve pain, to keep up with other athletes who use drugs. Analgesics and anesthetics are used to deaden pain and include both topical, the alcohols ethanol and methanol, procaine and lidocaine, oral, aspirin, ibuprofen, acetaminophen, hydrocodone, also known as Vicodin, meperidine, also known as Demerol, morphine, codeine, and propoxyphene, also known as Darvon. The biggest problem with analgesics and anesthetics is that they take away the pain without repairing the damage. And if you, so you've got a pain and you use one of these drugs, the analgesics or anesthetics, and now the pain goes away, and now you go out and exercise, and if you damage that area, of course, the pain's not there. So you don't know that you're damaging it worse. And that's the biggest problem with analgesics and anesthetics. And this is one of the reasons why people blow their knees out. They get Novocaine or Procaine or Lidocaine before they go out and play. And then they come back in, and as soon as it wears off, now they realize they have a lot more damage than they had before. Not a good idea. Muscle relaxants are drugs that depress the neural activity within skeletal muscles and are used to treat muscle strains, ligament strains, muscle spasms, tremors, or shaking. Carespradol, also known as Soma or Vanadom, methocarbamol, also known as Robaxin, the benzodiazepines, diazepam, which is also known as Valium, clonazepam, which is also known as Klonopin, and chlordiazepoxide, which is also known as Librium. When I was in the service, as I have told you before, the doctors would prescribe Librium and Valium to the women, the wives of the men who were overseas, especially if they were in Vietnam, because the women were anxious about whether their husbands would die in the war, and they gave them. We used to give Valium and Librium in 5-gallon buckets. The rest of them came in 1-gallon containers, plastic containers, but the Valium and Librium came in 5-gallon buckets. Anti-inflammatory drugs lessen pain as well as control inflammation. These drugs come in two classes. Non-steroidal anti-inflammatory drugs, or the NSAIDs. These are aspirin, ibuprofen, indomethacin, also known as Indocin, phenylbutazone, also known as butazolidine. I've never even heard of that one. Cilindac, Clinoral, and Celecoxib, which is also known as Celebrex. The corticosteroids, prednisone and cortisone. Both types of anti-inflammatories have their problems. NSAIDs, aspirin and ibuprofen, cause ulcers and kidney problems. Celebrex is only recommended for arthritis and may cause heart and gastrointestinal problems. Corticosteroids can cause water retention, bone thinning, muscle and tendon weakness, delayed skin healing, vertigo, headaches, glaucoma, psychosis at high doses. So you got to be careful, as he should have been. Asthma medications open air passages. 10% of the general population has asthma. Asthma is often aggravated by heavy exercise and stress. Exercise-induced asthma occurs in 11 to 23% of athletes. Most asthma medications used by athletes are beta-2 agonists. Clenbuterol is banned during competition, and albuterol. These medications increase muscle energy and growth, and for that reason, a lot of athletes claim to have asthma, but they actually don't. They're using albuterol as a steroid. Ergogenic drugs include anabolic steroids, stimulants, human growth hormone, pre-steroids, beta blockers, and erythropoietin. Ergogenic techniques include blood doping, soda doping, herbal medicines, and weight loss. Them some big boys. Anabolic steroids are synthetic androgens and are used for muscle building and muscle repair. These drugs are used routinely in medicine to treat testosterone insufficiency, delayed puberty, wasting diseases, osteoporosis, certain types of anemia, some breast cancers, and endometriosis. The endometrium, for those of you who are male, the endometrium is the tissue that is in your uterus. And endometriosis is a hardening of that endometrium. When athletes take steroids, they experience increased body weight, lean muscle mass, muscular strength, stamina, aggressiveness, and confidence. He looks pretty confident. Athletes taking anabolic steroids will take 20 to 200 times the prescribed daily dosage, and that's why they get so massive. Anabolic steroid users will use the drugs in from 4 to 18-week cycles. This is done to give the body a chance to recover from the drug use or to escape detection of use. Cycling steroids usually involves using more than one kind of drug. 82% of cyclers cycle 3 or more different steroids at a time. 30% use 7 or more steroids. Immediate effects of steroid use is increased muscle mass and improved muscle tone. Having muscle too large and strong for the bone and tendon structure may cause an overstressing of the muscles. This causes ruptured tendons and damaged ligaments. My daughter had a friend when she was living in Phoenix. She was living in Phoenix right after she graduated from high school, right after she finished her master's degree. Right after she finished her master's degree. So she was about 24 years old. Anyway, he was Mr. Olympia for the state of Arizona. He was a bodybuilder, and he claimed he never used steroids. But then one time he tore his pectoralis muscle away from his body. And at that point, everybody knew that he was using steroids because you can't do that. I mean, your pec is really a big muscle, and it's tied on in a lot of different places. And this guy ripped his pec off of his chest, lifting too much weight. And of course, he got it fixed. And then he stopped using steroids. Users often complain of feeling bloated. They have water retention, which is actually what makes their muscles so huge, is the fact all those muscles have water in them. One of the things that they have to do is what a bodybuilder will do, because he is forcing water into his muscles, into his muscle mass. What he will do before he has goes into competition, he'll take a diuretic to suck all that water out of there, and it will make him look more ripped. The problem is that he's been forcing all this water into his system, and when he takes a diuretic, it makes him dehydrated, and it can really cause a lot of damage, especially to the kidneys. And that's the biggest problem. Whoops, I'm sorry, I'm going the wrong direction. I'm really going the wrong direction. There we go. Okay, anabolic steroids suppress the natural production of testosterone. This is not good. Your body makes its own testosterone. Your body has the right amount of testosterone. Sometimes it doesn't, and you need to take testosterone supplements. But most men are fine, and then they take steroids, and all of a sudden their body stops producing testosterone. This is not good, because what will happen, well, I'll tell you what's going to happen. Causes enlarged breasts. It changes the nipple structure, decreases the size of your sex organs. This is both for males this is for males. For females, it actually increases the size of your sex organ. But for males, it decreases the size of their testicles and their penis. Impairs your sexual function, of course. Cystic acne growth, and this is what cystic acne growth looks like. And thinning of hair and more rapid balding. And this is one of the reasons why a lot of guys shave their heads when they're in their 30s and 40s. Not because they're actually balding, but because they took steroids when they were younger, and it thinned out their hair. So that's why they shaved. There you go. There's a guy that's ready for competition. He's drawn all the water out of his muscles. You can see he looks different than this guy. He looks more ripped than this guy, and that's because this guy's got water, and this guy's got water in his muscles. And these guys have water in their muscles. They're ready for a pose down. This guy is. He's taking his diuretics, and he's ready for competition. Female athletes also use anabolic steroids for muscle growth and other masculinizing effects, though some are unwanted. Increased facial hair. Women with beards are always attractive. Decreased breast size, lowered voice, clitoral enlargement, cystic acne growth, of course, and a thinning of their hair. Most of these masculinizing effects are irreversible, so once it starts, it will not stop. Now, I'm going to show you some pictures of women before and after. They use steroids. One of the things I want you to notice is the volume of their hair. And she's poofed up her hair to make it look more thicker. That's pretty stringy hair. Can't really see her hair on the left. There you go. Yeah, and you can see their facial features. This is looks like a lady. This individual doesn't really especially look that female-esque. She looks like a woman here, but not so much there. Same thing here. And she looks like a woman, both of them. Okay, we're not done. Here we go. This is the worst one. This is what she looked like before she decided to take steroids. And you can see how thin her hair is. You can see the masculinization of her facial features. Anabolic steroids increase the cholesterol of the user, especially the bad cholesterol, the LDL. People that take steroids die younger than they would if they didn't take steroids. Usually they die of heart problems, kidney problems, sometimes liver problems, because your liver is supposed to clear the LDL out of your system, or that's where the transfer of LDL and HDL takes place. At the same time, the steroids lower the good cholesterol, or the HDL. Steroid users have an uncommon amount of cardiovascular problems, hypertension, thrombosis, cardiomyopathy. I had a friend who was a bodybuilder. He was getting ready for a competition, and he started having blood clots in his legs. Not a good situation. Could have had a stroke, but he's a dummy. He just kept going despite the blood clots, and he won the competition. So I guess everything's okay. Because steroids encourage cell growth, they may equally encourage cancer cell growth, usually brain tumors, as weird as that may seem. Anabolic steroids do have an impact on the user's mental state, at first supporting more aggressive and confident behavior. As use continues, confidence swings to aggressiveness, to emotional instability, to rage, to hypomania, to depression, to psychotic symptoms, to paranoia. This emotional cycling is known as roid rage, and is more pronounced in individuals who have anger issues before they start taking steroids. While some people report a slight euphoria when taking anabolic steroids, it is thought by researchers that this is due to anticipation of intense activity rather than actual addiction. Some users do report withdrawal symptoms, and in fact, some users will use low doses during cycling to maintain sanity. There is some animal study evidence that steroid use is addictive. Stimulants are taken by athletes to make them more alert, to make them feel more confident, and to make them stronger. Much of the increase in ability when taking amphetamines is increased focus and aggressiveness. Heavy usage can lead to blood pressure problems, exhaustion, and malnutrition. We're talking about the steroid era in baseball. If you're a baseball fan, you know that there are people who have taken steroids and they won't admit them into the Hall of Fame. Barry Bonds is one of them. Roger Clemens is another. These individuals. One of the things you need to know about baseball is the baseball players have always used things. Before it was steroids, it was amphetamines. So we have the amphetamine era, and all those guys have made the Hall of Fame. It's really kind of interesting. That was in the 70s and 80s. There were a lot of people using stimulants. After the 80s, the only edge they could get was steroids. So they used steroids for a number of years, and we don't know where it's going to go from here. but before they used stimulants, they used tobacco. Tobacco is very common. And tobacco, of course, is a stimulant. We know it's a stimulant. They used to chew tobacco, and this went back all the way to the beginning of baseball. So people have always looked for an edge. Caffeine is a mild stimulant used by some athletes. At low doses, it increases your wakefulness, your mental alertness, it slightly increases your endurance, your muscle contraction, digestive disturbances, urine output causing dehydration. It makes you pee. Ephedra or mahuang and ephedrine are mild stimulants used by some athletes. These substances are found in many over-the-counter medicines. Not everyone is sensitive to these medications, but to those who are they cause jitteriness, anxiety, headaches, high blood pressure, cardiac arrhythmia, poor digestion, and overheating. This is an individual that actually died from using mahuang. He was a pitcher for the Cleveland Indians, and he was using it while he was pitching, and then when he went off the field, he died of cardiac arrest. And when they checked him, they found out that he had been using mahuang. Chewing tobacco used to be a mainstay in Major League Baseball parks from the beginning of the baseball until into the 1980s. Many, if not most, baseball players maintained a chaw of tobacco in their cheeks almost constantly during a game. Many baseball icons of the past died of throat or esophageal cancer. It is rarely seen today. And there are two cases. This is Nellie Fox, famous for he had the biggest chaw. He was a second baseman for the Chicago White Sox. When they won the American League pennant in 1959, he was their second baseman. And who was their shortstop? Louis Aparicio. Anyway, this is Pablo Sandoval. He's where is he? He's from Venezuela, I think. Maybe Nicaragua. I can't remember. Anyway, he, as you can see, he's got a chaw. Also, he played last year for the world champion Atlanta Braves. Human growth hormone is a hormone produced by the pituitary gland to stimulate growth in children. It is prescribed for children who are of unusually small stature to stimulate growth, and for people with wasting diseases like AIDS to build their strength. It is used by athletes because it increases their muscle mass, skin thickness, connective tissues, and muscles. Acromegaly, it causes acromegaly. It can cause cardiovascular disease. If you are using it, you're not supposed to use it unless you've got a problem. Otherwise, you've got enough in your system that you shouldn't need it. But of course, baseball players are using it. Cardiovascular disease, decreased sexual desire, goiter, menstrual disorders, and impotence for women and men. Decreases your lifespan up to 20 years. This is a picture of Ryan Braun. He was the National League MVP in 2011. In 2012, he was suspended from baseball for half the season because of they found HGH in his system, or more than he was supposed to have anyway. And he admitted that he was using it to recover from an injury, but he had used it the year before when he won the MVP. He retired last year, so he's no longer in baseball. That's what acromegaly looks like. As you can see, it elongates your jaw. And androstenedione or andro and dihydroepiandrosterone or DHEA are natural hormone precursors to testosterone. In other words, you have these two in your body and then they become testosterone. Neither of these supplements have been found to do more than increase testosterone levels in men with abnormally low testosterone levels. Here's the weird part. If you take andro and you take DHEA, and you have a normal testosterone level, it doesn't raise your testosterone level. It just keeps it, nothing happens. They also seem to increase HDLs and the female hormone estradiol. So potentially, the HDLs will help your cholesterol level, and the estradiol will make you feel more feminine. Beta blockers are medications prescribed to lower blood pressure, to decrease your heart rate, prevent arrhythmias, reduce eye pressure. They work by blocking adrenaline from exciting the heart. They also calm the individual by blocking nerve cells in the brain. Beta blockers are used by athletes who require precision and concentration, like archers, participants in rifle shooting competitions, ski jumpers, and divers. Beta blockers do have their problems as they cause fatigue, lethargy, dangerously low blood pressure, gastritis, occasional nausea, vomiting, temporary impotence. It may intensify your asthma. It intensifies your heart problems that may kill the user. Once upon a time, I had an uncle named Bill, and Uncle Bill had high blood pressure, and he took beta blockers. So while he took beta blockers, he couldn't engage in sexual congress with his wife. And so Uncle Bill decided that he would go off his beta blockers. And he asked my mother if she thought that was a good idea. And she said, no, that's not a very good idea. And Uncle Bill said, well, if I go back on them after I have sexual congress with my wife, then everything should be fine. And he did go off it, and eventually he did have sexual congress with his wife, and it wasn't very long after that he died of a heart attack, as sad as that is. But, of course, it was his choice. That's what happens. Uncle Bill died from not taking his blood pressure medicine. This was in the old days. Now they have blood pressure medicines that don't interfere with sexual congress. It does lower your blood pressure, but it doesn't cause any problems. Erythropoietin, or EPO, is a medication that is given to individuals to promote red blood cell production. It is often given to individuals who are going through chemotherapy to induce their bone marrow to produce replacement RBCs due to their problem. And this is what my sister did. My sister would get real anemic, and then she'd go in and she'd have an EPO shot, and it wouldn't be immediate, but in a couple days, she felt like $1 million because she was producing more red blood cells. EPO is used by athletes to increase stamina, though the unnatural thickening of the blood can lead to blood clots, which in turn might lead to strokes or heart attacks. A similar problem is blood doping, where the athlete stores their own blood prior to competition and then are administered the packed red blood cells to increase the stamina of the individual. This is done especially with cyclists because they need the stamina. This technique is used in endurance sports such as cycling, long distance running, and cross-country skiing, but we see it most often in cycling, especially the Tour de France. Lots of problems in the Tour de France. They'll do just about anything to get an edge over the competition, including taking EPO and blood doping. And also taking steroids or testosterone supplements. Athletes will use just about any substance that will give them a competitive edge: herbs, animal extracts, vitamins, minerals, proteins. Unfortunately, some of these items may contain banned chemicals and cause the athlete a great deal of trouble. One dietary supplement used by athletes is creatine. Creatine is an amino acid that occurs naturally in the human body, as well as in fish and meats. Creatine is used because it delays muscle fatigue. It stores energy that can be used in short bursts. It extends the amount of time a person can work out. It helps muscles recover faster. Problems come when it is overused. It causes dehydration. stomach cramps, nausea, and diarrhea, muscle pulls and strains, and of course, kidney problems. And this is a guy, this is what he looked like on day 1, and this is what he looked like on day 6 after taking creatine. As you can see, his chest and his biceps are especially larger. His deltoids look bigger as well. Gamma hydroxybutyrate, GHB, was used in the 1980s and early 1990s as a fat burner, as an anabolic agent, as a sleep aid, as a muscle definer, as plant growth supplement, and as a psychedelic. It was picked up by sexual predators as a date rape drug and is now only used legally as a medication for muscle weakness. And that is a picture of a guy dropping GHB in drinks so that he can have his way with someone. It is GHB that Bill Cosby used to anesthetize his rape victims. Some athletes will consume sodium bicarbonate 30 minutes prior to exercising to decrease the development of acidosis. This works for shorter events that take place within 10 minutes, but not for longer endurance events. It can cause diarrhea and water retention. Athletes trying to make weight will resort to various techniques to drop unwanted pounds, diuretics, laxatives, exercise, fasting, self-induced vomiting, excessive sweating in the sauna, and stimulants. Some athletes will lose 3 to 5% of their body weight in a couple of days. This was used to be a really serious problem with wrestlers, especially back in the 80s and 90s. But the medical community started cracking down on this, and they tried to talk coaches into not having people that were naturally a certain weight wrestle at a lower weight. It seems to have worked to some extent. I can remember when I was teaching high school, our wrestlers would spit, they would take diuretics, they would wear plastic outfits, to lose weight, to lose water weight. Actually, all they were losing is water weight, but they needed to make weight so that they could wrestle at a lower level. Anorexia and bulimia are not uncommon among athletes who are potentially trying to make unrealistic weight levels. Another problem with weight maintenance is the opposite of anorexia, muscle dysmorphia, where the individual becomes obsessed with muscle development as they see themselves as too weak whenever they look in the mirror. These individuals are more likely to take copious supplements and steroids to combat their body's weaknesses. Athletes will often use diuretics to lose weight rapidly, to limit the bloating caused by steroids, by sucking the water out of their system to avoid detection of illegal drugs, and to lose weight to look thinner. Athletes need to monitor their use of diuretics because of the possibility of dehydration leading to heat stroke and organ damage, and the organ damage usually is their kidneys. Weightlifters will take adrenaline supplements combined with amyl or isobutyl nitrite to increase their strength. It unfortunately can cause dizziness, rapid heartbeat, and hypertension. Bee pollen is sometimes taken as a supplement, a way of boosting energy levels, digestion, and reducing stress. Studies do not support any benefit from taking bee pollen. Some athletes will take calcium pangamate as a supplement. This chemical combination is sometimes referred to as vitamin B15 and penjamic acid. It is refuted to keep muscle tissue better oxygenated, though there is no scientific research to back up the claim. This substance is known as is a known carcinogen, penjamic acid, or omega B15. Cyproheptadine or periactin is reputed to be a steroid-like bodybuilder and has been used to increase body weight and muscle strength. This drug is an antihistamine. It acts as a serotonin and histamine antagonist and increases muscle mass and strength by making the individual hungry. It actually merely increases the user's appetite and has the added side effects of decreased performance, sweating, and sedation. Darbepoetin or Aranesp is a medication developed to treat chronic anemia. Just like erythropoietin, the drug increases RBCs and thus the oxygen carrying capacity of the athlete's blood. Human chorionic gonadotropin is a substance produced by fetuses to protect themselves from their mother's immune system. HCG, along with clomiphene and tamoxifen, is taken by steroid users to restart their own body's testosterone production. This substance also blocks the increased effects of estrogen in the male body. The drug can have an impact on the liver and the reproductive system. There was a baseball player once upon a time, number 99, Manny Ramirez. People thought, he was kind of a mediocre baseball player. Then all of a sudden, he just became really good. His batting average was amazing. Played for Boston, then he played for Los Angeles. Boston made the World Series, and Los Angeles won the World Series, or played in the World Series. I guess they lost. But the next year he was caught with HCG, too much, or HCG in his system. There's no reason why you should have human chorionic gonadotropin in your system. The only reason that women have human chorionic gonadotropin in their system is the human chorionic gonadotropin that is being produced by a fetus. So they would have to be pregnant to have HCG in their system. There's no reason in the world for a man to have HCG in his system. And he was caught with HCG in his system. So he was banned for a year. Then he came back. He came back and he wasn't nearly as good because he wasn't taking steroids, and he retired, I guess, after that. Modafinil or Provigil acts as a stimulant and is used to treat narcolepsy. Athletes using the steroid THG will take the drug to mask the steroid. Orethine and arginine are amino acids taken to increase muscle mass because it is reputed that they cause an abnormal release of human growth hormone. Primogen is used in Europe to facilitate the release of steroids in the body. Vitamin B12 is used to ward off illnesses and provide extra energy. It can also be used to speed the recovery from a hangover. We used to, when I worked in a clinic in a rural health clinic in Chandler, Oklahoma, we used to give people B12 shots if they had the flu, or if they came in complaining of flu-like symptoms. Sometimes it was a hangover. Anyway, we'd give them B12 shots. It was B12 and B6, I think, if I'm not mistaken. As has been seen, athletes will do just about anything and take just about anything to improve their performance on the athletic field. Athletes will use stimulants to boost their performance, from innocuous caffeine and tobacco to more destructive amphetamines. Athletes will use sedative hypnotics, especially Xanax, to unwind from the stresses of competition. Sometimes these drugs are used to counteract the stimulants they have taken to perform. The most widely used depressants by athletes is alcohol. While in low doses, the substance does not hinder performance. In most cases, alcohol is used as a reward for performance, as a way to unwind, or as a consolation after a disappointment. Marijuana is contraindicated for performance, though when used in the right mood, might actually improve performance. Marijuana doesn't help athletes because it lowers your blood pressure, causing fainting during competition. It inhibits sweating, which might lead to heat prostration during exercise, decreasing tracking ability, hinders the ability to do complex tasks, diminishes hand-eye coordination, decreases oxygen intake. It is banned. It is a banned substance by the NCAA. It is illegal in 36 of 50 states. So what are we talking about? Actually, it's now 30 out of 50 states. That's an old number. Because marijuana is fat soluble, it continues to impair for 1 to 2 days after use. I told you the story of playing in a softball tournament. It was an all-night tournament, and we played this one team earlier in the day, and they kicked our butts. And then we came back and played them in the evening, but they'd been smoking pot, and we almost killed them. I mean, literally, because they couldn't catch the ball. All of a sudden, they couldn't catch the ball. So marijuana is really contraindicated as a athletic enhancing substance. There are no limits to what people will do to get high. People have been known to smoke aspirin, to chew dandelion roots, to drink gasoline. Individuals who have been known to mix gasoline with orange juice to make a barely palatable concoction known as Montana gin. It would be known as Montana gin. Drinking rubbing alcohol, drinking hydrogen peroxide, to put Anbesol, which is a topical anesthetic, in their eye, to smoke toad secretions, and to eat dandelions, obviously. Mortuaries have had to watch their supplies of the fluid they use to embalm bodies, that is formaldehyde. When inhaled, this substance acts as a depressant and a psychedelic, but can also be used to manufacture illicit drugs. When mixed with marijuana, the substance provides a PCP-like effect and is called clickers, clickums, fry, wet, and illy. Illy, formaldehyde, and marijuana. Raid, Lysol, and any hairspray are sometimes used for their alcoholic content. Raid has been used to spray on marijuana to intensify the effects of the marijuana in a concoction known as Canaid. Kava is a plant found in the South Pacific and South America. The root is crushed and a milky white exudate is extracted, which is drunk like alcohol. The drink is reputed to have similar effects as alcohol and acts as an anti-anxiety drug. It is said to have an unpleasant flavor and numbs the tongue and lips. They use human saliva in its preparation. In some Arab countries, camels are force-fed marijuana. After going through the digestive process, the camel dung is smoked for its hashish content. The bufo genus of toads, the Colorado River toad, produces a psychedelic substance from its pores as a defense mechanism from attack. The toads are sometimes milked, and the resulting substance is smeared on cigarettes and smoked for their psychedelic effects. And that's what a Colorado River toad looks like. All natural medications started, it's a bufo. The bufo is the genus. So if you can find a bufo, a toad that is from the bufo genus, they all do this. They produce this psychedelic substance. All natural medications started out as herbal preparations concocted by shamans, medicine men, wizards, or physicians. Some of these herbs merely had a placebo effect, while others have been proven to contain chemical structures that have great benefits for mankind, such as quinine, which was developed from the cinchona tree to fight malaria. The search for the fountain of youth, or merely drugs that will help the individual recover from a hard night of drinking, have recently come to the fore as smart drugs or drinks and nootropics. Smart drugs, drinks, and nootropics are drugs, nutrients, vitamins, extracts, verbal potions such as ginseng, ginkgo biloba, and caffeine, and also amino acids. These drugs are reputed to boost your intelligence, to improve your memory, to sharpen attention, to increase concentration, detoxify the body, energize the user, and reverse the aging process. Okay, so here we are. We're taking all these crazy drugs. We're smoking, we're drinking, we're taking drugs, and it shortens our life. And we know it shortens our life. But here we are, all of a sudden, we're taking things to boost our intelligence. All of them make you stupid. So here we are. We're taking other drugs to boost our intelligence, improve our memory, sharpen our attention, increase our concentration, detoxify our bodies, energize the user, and reverse the aging process. New age smart drugs or nootropics include hydrogene, selagelene, vasopressin, 5-HT, modafinil, paracetam, and oxyracetam. They are supposed to improve your learning, to improve memory consolidation, and improve memory retrieval. Sometimes I could use something like that. Compulsive disorders are repetitive behaviors that the individual appears not to have any control over. They come in two categories: impulse control disorders and compulsive disorders that have their own classification. Impulsive control disorders include compulsive gambling and hair pulling. That's what she's doing. Compulsive disorders that have their own classification: overeating, shopping, sexual behavior, internet use, watching television, pathological lying, shoplifting, and fire setting. Impulse control disorders are actions that may be pleasurable in the beginning, but as the attempt to resist the impulse continues, it becomes harmful to the individual or to others. This disorder also has accompanying tension or arousal before the act is committed. After culmination of the act, the individual often feels gratification, pleasure, relief, and then possibly remorse and guilt for not controlling the behavior. Obsessive-compulsive disorder is a repetitive activity where the goal is to reduce anxiety or distress caused by the obsessive thoughts. The goal is rarely to provide pleasure or gratification and includes compulsive hand washing, checking things, ordering, counting, and praying. Compulsive behaviors are engaged in for the same reason people compulsively use addictive drugs. Sorry, I needed a drink. Instant rush, forget problems, control anxiety, oblige your friends, self-medicate. These individuals are trying to alter their mood and change their state of consciousness. MRIs show that the same areas of the brain are activated when compulsive behavior is done as when drug use is anticipated or done. Drug users are compulsive about their drug use. Compulsive gamblers gamble compulsively. Drug users develop a tolerance for their drug. Compulsive gamblers increase the bet amount when gambling compulsively. They build up a tolerance. Drug users have withdrawal symptoms after abstinence. Compulsive gamblers become restless when not gambling. This is a form of withdrawal. Drug abusers continue to use despite adverse consequences. Compulsive gamblers continue gambling until they have used all their money. This is, of course, a form of abuse. Drug users are in denial about their usage. Compulsive gamblers think they control their gambling and refuse to see the consequences. They're in denial. Drug users have a strong tendency to relapse. Compulsive gamblers will relapse whenever they have money again. And I've been around compulsive gamblers. I'll tell you what, they're really irritating. They will borrow money from you, promising that this is the last time. It is never, ever the last time. As soon as they get more money, they'll gamble again. One telling sign is that organizations like Gamblers Anonymous and Overeaters Anonymous use a 12-step program identical to the 12-step program set up by Alcoholics Anonymous. Addictive behavior involves a lack of individual control, and these organizations demonstrate the necessity to change their lifestyle and beliefs. Compulsive behavior can be triggered by various factors: genetic predisposition, environmental stress, the repetitive behavior itself. Substance abusers, compulsive gamblers, compulsive overeaters, and compulsive shoppers all show the same dopamine increase in the brain. Compulsive behavior does seem to run in families. Binge overeating has been shown to have a relationship with overactive 5-HT serotonin receptors. Twin studies support the strength of genetic factors leading to obesity. These connections were stronger than shared environmental pressures. Studies of adopted children supported the strength of genetic influences where such environmental factors such as frequency and volume of meals, amount of snack food in the house, and level of exercise was less significant than heredity toward obesity. And the reason I have this picture is because these are all orphans who are being taken care of by the Catholic Church. Orphan studies, isn't that what it said? Adopted children. Researchers have found a marker gene that shows a strong proclivity for the addictive behavior, especially alcoholism. It's DRD2A1 allele. It appears in only 19 to 21% of non-alcoholics, but it appears in 69% of severe alcoholics, in 45% of the compulsive overeaters, 48% of smokers, 52% of cocaine addicts, 51% of pathological gamblers, 76% of pathological gamblers with drug problems, 45% of people with Tourette's syndrome, and 49% of children with ADHD. That's a DRD2A1 allele. Whoops, I'm sorry, I went the wrong direction. It is speculated that these individuals who have the DRD2A1 allele gene have a deficiency of dopamine receptor sites, and therefore they must seek excessive stimulation to force extra dopamine to be released in the reward reinforcement pathway to feel normal. Since our normal is less stimulating, bored, stimulation allows them to feel pleasure. Compulsive gambling may be triggered by the plethora of venues to gamble: state lotteries, poker machines, internet betting, legal off-track betting, casinos on every corner. Compulsive overeating may be triggered by the plethora of fast food restaurants, lack of daily physical activity, fats and sugars in the foods that induce craving, parents overfeeding their children, chaotic childhoods that lead people to use food to relieve their depression. Compulsive sexual activity may be triggered by a plethora of sexual situations depicted on TV, latchkey kids with no supervision, children with no close emotional family connections, and an abundance of internet pornography. And I'll tell you what, you can type just about anything in to the internet and it will come up with pictures of nudes, as weird as that is. So if you have children, you need to do the search thing where you can block those pornographic sites. Compulsive internet use may be triggered by expanding network of games, massive multiplayer online role-playing games. Dedicated gamers will play online for an average of 8 hours a day. Expanding networks of online gambling, expanding network of chat rooms. Compulsive shopping may be triggered by the ease of getting credit, a materialistic view of life. It isn't who you are, but what you have. Barrage of advertisements on TV, catalogs, 24-hour home shopping networks, internet shopping, internet auction sites. It has been observed that there is a history of emotional, physical, and sexual abuse in the lives of many of the individuals who suffer from compulsive behaviors. Engaging in the behavior can lead to compulsive behavior, a big payday when gambling. Eater takes in excessive sugars and fats and changes the body chemistry. Now they eat to be happy. Being able to buy something that the individual wants makes them shop with the anticipation that they will find another coveted item. Participation in ritualized masturbation, compulsive viewing of pornography, or participation in other compulsive sexual behavior will make the individual avoid normal sex behavior or emotional relationships. Compulsive gambling has skyrocketed in the last decade, with poker tournaments being shown on television and online gambling available. Last year, gambling revenues in the United States topped $75 billion. Last year, gambling revenues worldwide topped $125 billion. Gamblers Anonymous defines gambling as any betting or wagering for self or others, whether for money or not, no matter how slight or insignificant, whether the outcome is uncertain or depends upon chance or skill, constitutes gambling. Forms of gambling: casino-style gambling, poker, blackjack, craps, roulette, slot machines, video poker machines, horse and dog racing, jai-alai, bingo and raffles, state-run lotteries and keno, sports betting, both legal and illegal, Super Bowl office pools and betting on golf, schoolyard games, lag pennies and flip coins, bar games, liar's dice, stock speculation such as day trading, commodities and options, and internet gambling. Of course, March Madness just occurred, so I have my bracket. I'm sure it's a loser. Michigan did win today, and I picked Michigan to win, so I guess I'm ahead by one. I don't know who else won. Gambling has been around since the dawn of man. Gambling bones have been found in human habitation sites that date back 40,000 years. This was not an old world phenomenon. Mayan digs have found gambling implements that closely resemble the dice and bones of other civilizations. So it was also in the old world and the new world. Along with gambling has come attempts at prohibition. India in 1000 BC tried to stop gambling. During the Roman Empire, it was only for the aristocracy. Louis IX of France in 1255 outlawed gambling. Henry VIII of England outlawed gambling. And during the Victorian era in the United States, gambling became illegal. And that's an answer to a question on your quiz, the Victorian era in the United States. Gambling came to the United States with the British, but the corruption and the addictive behavior made the practice unpalatable, and it was banned. While it was banned in the East, as people moved across the Mississippi River, gambling was popular in the Wild West. Infected by the same corruption and Victorian morality, by 1910, it again was gone. Gambling didn't return until the 1970s. I want you to notice this. Gambling became illegal in 1910. And for 60 years, we didn't gamble in the United States. Now, I was born in 1949. Gambling didn't return until the 1970s. So for the first 21 years of my life, there was no gambling in the United States. Since then, Atlantic City and Las Vegas have become gambling meccas, and Indian casinos have changed gambling attitudes, bringing in more money than the cities combined. 48 states have some form of gambling. The only two states that don't have gambling are Utah and Hawaii. Strangely enough, they are the two most Mormon states in the United States. If you've ever been to Hawaii, there's a Brigham Young University of Hilo, I think. Anyway, it's on the Big Island. It's on Oahu. Gambling in the United States started with the Indian casinos. It started down in Florida with the Seminole. They had a bingo hall. And, of course, the Indian reservations were controlled by the federal government. And so the Seminole, and this is in 1968, the Seminole petitioned the federal government to allow them to have gambling in to have a bingo hall. And who was the president at the time? Richard Nixon was the president. Yeah, Nixon was the president. And Nixon decided he didn't want to have anything to do with it, didn't want to mess with it. So he said, I don't care. I'm not even, this is not a federal thing. We're just going to let the states decide whether you can have gambling or not. And that's why one of the reasons why there was gambling in all the states that had Indian reservations. And then, of course, people like Donald Trump decided that, hey, that's not fair. We need to have gambling, and I need to be able to control gambling too. So they started gambling in Atlantic City, and Las Vegas, of course, they were able to open up gambling in Las Vegas. Compulsive gambling, like any other addiction, comes in two forms. Problem gambling, gambling behavior that causes problems in an individual's life, psychological problems, physical problems. sociological problems, and of course, vocational problems. Pathological gambling, behavior that is persistent and continual and significantly disrupts all aspects of an individual's life. The real difference between problem and pathological gamblers is often time and money. Problem gamblers can't afford to spend as much time and they don't have the money to gamble as they want. They average losses of about $3,000 per year. A pathological gambler spends more time gambling and averages losses of $11,000 a year. The average debt for women entering Gamblers Anonymous is about $60,000. The average debt for men entering Gamblers Anonymous is $100,000. The individual that shot up Las Vegas and killed however many people he killed, he was a chronic gambler, pathological gambler. Studies show that problem and pathological gamblers lose 10 to 20 times as much as non-problem gamblers. In a study in Connecticut, 47% of the casino patrons were problem or pathological gamblers, even though they only comprise 5% of the population. The largest Indian casino is, oddly enough, in Connecticut. It's Fox something. Anyway, it's the Pequots. The Pequots are the ones that own that casino. In Minnesota in 1993, it was discovered that 2% of the population generated 63% of the state gambling revenues. Harvard Medical School studies estimated that 125 million people in the United States gamble, and I am not one of them. 2,200,000 of these individuals are pathological gamblers. 5,300,000 of these individuals are problem gamblers. This didn't take into account the 1,100,000 adolescent pathological gamblers. Male compulsive gamblers outnumber female compulsive gamblers by 2 to 3 times. This may be changing with the increase of casinos and slot machines, as women are more likely to use gambling to escape depression, trauma, or relationship problems. Pathological gamblers tend to have other addictions. 25 to 63% of pathological gamblers have other behavioral or substance addictions. One study found that 73% of pathological gamblers had alcohol problems. The same study found that 38% of pathological gamblers had a drug problem. And this is one of the reasons why they give you free booze at casinos, especially in Las Vegas. They're trying to get them drunk. Now, if they're alcoholics, you're going to have to give them lots of booze in order to get them drunk so that they lose as much money as they can. The same study found that 38% of pathological gamblers had a drug problem, 60% smoked, 50% had mood disorders, 41% had anxiety disorders, 60% had personality disorders. The group that has seen the greatest rise of gambling is among older adults. One survey of residential and assisted care facilities found that 16% went to casinos at least once a month. This behavior is exacerbated by casino-sponsored trips and day trips, which were found in 2/3 of the facilities. College students gamble at a higher percentage than any other group. 42% gamble, 26% gamble weekly or frequently. Heavy college gamblers were more likely to be smokers, heavy drinkers, and or heavy marijuana users. These individuals average lower grades and more frequent absences. And there you go. That's what you need to do. Drinking beer from a pitcher when somebody's pouring it into your mouth. Different types of gamblers, recreational social gamblers, are able to separate gambling from the rest of their lives. For professional gamblers, their main source of income is gambling, and because of this, they're able to and willing to take losses in their business. Antisocial gamblers may steal to gamble and have no conscience about the thievery and corruption that they represent. Usually they start off with their own family. There are 2 subtypes of pathological and problem gamblers. Action-seeking gamblers are frenetic, excited, and are always seeking the escape. Escape-seeking gamblers are drawn to gambling machines and are often responsible people with good jobs, but they begin gambling to escape from their emotions or just to escape boredom. The symptoms of persistent recurrent pathological gambling, preoccupation with gambling, reliving past gambling experiences, planning future gambling, increasing the amount of money used in gambling, unsuccessful attempts at stopping or curbing gambling, restlessness and irritability when not gambling, using gambling as an escape, chasing, trying to recoup past losses, lying about gambling, financial gambling through illegal acts, jeopardizing job, relationship, and education to gamble, expecting others to bail out the gambler's debt. I had a friend in Montana who was a gambler. I think I told you about him before. He was kind of interesting. If you asked him, he one one time I went up to fix my house, and I hired him to help me fix the house, and I was paying him $100 a day. So at the end of the day, I'd give him $100. And then I'd pick him up the next morning and I'd take him to breakfast. And I always asked him, well, how'd you do last night? Because he was a gambler. And he'd say, oh, I won $300. I won $300. Wow, that's great. So you got $400. He'd say, no, I don't have any money. I lost it all. But he would always talk about how much money he won, as if, that was the important thing. And of course, being me, I thought how much money he got left over. Anyway, it's really kind of funny. He worked for me for 5 days. I gave him $500, and in that time, he won about I don't know, $3,000 or $4,000. But when I left, he didn't have any money at all. He had lost every penny of his money and all the money that I had given him. Winning phase: in the beginning, the bets are small and they're happy just to win or break even. But as recreation becomes compulsion, the reward becomes more the stimulation of the action, and they seek to prolong the action as long as they possibly can. Winning becomes secondary to staying in the game, and that's what my friend was doing. In 70 to 80% of the cases, the good news is he was gambling at his local casino, and his local casino was owned by the tribe, so that was a good thing. At least the money went to the tribe. In 70 to 80% of the cases with the compulsive gamblers, the beginning of their craving for gambling started with a big win. The gambler begins spending more time wagering, and their conversations are salted with lionizing their wins, and when mentioned, minimizing their losses, as he did. I'd have to ask him how much money he had left over. He never volunteered the fact that he had lost all of his money. Losing phase: the losing phase begins with a losing streak, which is inevitable due to the simple laws of chance. Their large losses are met with larger wages to try to recoup their previous losses, and this is known as chasing. As the gambler continues to lose, they will dip into depression. They will seek isolation, become irritable, and of course they'll lie about their situation, especially to their spouse. Luckily, this guy wasn't married, so he didn't have to lie to anybody. Desperation phase: in the desperation phase, the pathological gambler may lose their job, max out their credit cards, borrow money from friends and family, perhaps turn to illegal activities to hide their addiction, theft, embezzlement, drug dealing. The gambler may bankrupt their family and suffer divorce. And of course, luckily, this guy didn't have to do that. He was already not married, and I wasn't going to lend him any money. That's for damn sure. Giving up phase: in the giving up phase, the gambler is no longer trying to recoup their losses, but seeks the game to stay in the action. 72% of gamblers experience depression when they hit bottom. Suicide attempts occurred in 17 to 24% of these gamblers when bottom was hit. This is usually the time when the gambler seeks treatment. I had another friend who was a pathological gambler up in Montana. After I left Montana, he called me on the phone. He needed to borrow $1,500 to fix his car. That's what he said anyway. I didn't send him $1,500. I knew where that $1,500 was going, and it wasn't going into his car. Anyway, For the compulsive gambler, it isn't the money that they are seeking, but the rush from the large win and the zoning out of the gambling that gambling affords them. About 1/3 of compulsive gamblers recover on their own, usually triggered by devastating financial losses. For the other 2/3 who seek treatment, the techniques used include antidepressant therapy, anti-craving drugs such as naltrexone, and of course, Gamblers Anonymous. Compulsive shoppers and hoarders have the same cravings as do gamblers and drug addicts, but in this, the high is caused by the feeling they get when they purchase an item. 74% of the time, compulsive buyers purchase items on impulse. 50% of the household income for these compulsive shoppers goes to paying their shopping debts. Compulsive shoppers tend to buy items that enhance their sense of uniqueness. Women buy jewelry, clothes, and cosmetics. Men tend to buy high-end, high-tech electronics and sporting equipment. Depression seems to be the main impetus behind their compulsive shopping. I had a relative who had a compulsive shopping problem. He bought fishing equipment, even though he didn't have any time to go fishing. And he bought this fabulous fishing boat. And of course, he never ever went fishing. But he had to have it. He had all this electronic equipment for spotting fish, schools of fish and whatnot. It's the dumbest thing in the world. Depression seems to be the main impetus behind their compulsive shopping. It seems worse during the winter holidays, so this is the time when they accrue 40% of their debt. Antidepressants reduce their urge to compulsive shop. Collecting, accumulating, and hoarding are offshoots of compulsive shopping. The individuals gain self-worth and self-esteem from the objects that they own. These collectors and hoarders may buy valuable items, contemporary fads, or accumulate valueless items. There are cases of people who are unable to throw newspapers and magazines away. People also hoard animals, cats, dogs, and birds. In 1980, 15% of the adult population in the United States were considered obese. By 2005, 33% of the adult U.S. population were considered obese. Tragically, only 33% of the adult population are of normal weight. The average height of the United States female is 5'4", with a weight of 164 pounds. The average model in the United States is 5'9", with a weight of 110 pounds. That's what normal looks like. This is what models look like. That's what models look like. This is what normal looks like. This is what normal looks like. This is what a model looks like. There are 3 eating disorders: anorexia nervosa, body image distortion, and an addiction to lose weight; bulimia nervosa, eating excessive amounts of food and then controlling weight by purging, such as vomiting, fasting, or excessive exercise; and binge eating disorders, eating excessive amounts of food with no attempt at weight control. Compulsive eaters feel powerless when dealing with food. These individuals tend to be obsessed with food. They use food to escape undesirable feelings such as boredom and depression. They have secretive behavior about their food. They feel guilty about their food. Normally, they are in denial about their food. They continue overeating behavior despite the harm that it does to them. Eating disorders seem to be a combination of genetic, neurochemical, psychological development, and sociocultural factors. 90.3% of the U.S. adult population is diabetic. That's 19,300,000. 26% of the U.S. adult population are at risk for diabetes. That's 54 million people. 15.5% of American Indian adults has diabetes. 10% of African American adults has diabetes. 6.5% of Mexican American adults has diabetes. 5.6% of white adults has diabetes. It is uncommon for someone with an eating disorder to have a co-occurring disorder as well. It is not uncommon. Okay. 12 to 18% of anorexics abuse alcohol, tobacco, amphetamines, prescription drugs, or other over-the-counter substances. 30 to 70% of bulimics abuse tobacco, alcohol, amphetamines, prescription drugs, or over-the-counter substances. I have no idea why I put a picture of Kaylee Cuoco in here, except she is she exercises a lot. Most eating disorders begin during adolescence. Adolescence, they tend to be chronic and affect women more than men. 3% of women suffer from one of the three eating disorders. In high school, 33% of girls and 16% of boys show symptoms of one of the eating disorders. This is really kind of interesting. This is Snooki, and I can't remember her last name, but she was on Jersey Shores. This is Snooki when she was a cheerleader before Jersey Shores started. And there's Snooki when she was in Jersey Shores. And this is Snooki after she left the show, or after the show closed. So as you can see, she had a problem with anorexia. And she didn't have a problem while she was on the show. And then afterwards, she had a problem on the show again. Now, the interesting thing about Snooki is that she's actually adopted out of Peru. She is native. She is Quichua. And so she's not actually Italian like everybody else was. She's actually indigenous. One of the frightening statistics dealing with anorexia, and obviously she has anorexia in this picture, and she had anorexia when she was a cheerleader in high school. One of the frightening statistics dealing with anorexia is that the age of onset has dropped from 13 years to 9 years. Third grade girls are starting to diet and starve themselves to look thin. Anorexics seem to have a fear of gaining weight. These individuals tend to have a tendency to perfectionism and a low self-esteem. This is called a thigh gap, this right here. And this is what they're looking for. Oh, you can't see it. She's got her legs crossed. Wait a minute. Oh, you can't see them, can you? Thigh gap. That's a thigh gap. You can't see it very well there. Okay, anyway. That's what they're seeking, this thigh gap. Anorexics seem to have a fear of gaining weight. These individuals tend to have a tendency to perfectionism and a low self-esteem. Death rates for anorexics range. This is a death rate for people that have this problem. The death rate is between 4 and 20%. Bulimia nervosa is a disorder characterized by binge eating and the obsessively ridding oneself of the food that has been eaten by vomiting, laxatives, diuretics, and excessive exercise. Bulimia actually means ox hunger, as in hungry enough to eat an ox. When binging, these individuals eat as if they were famished to the point of uncontrollably distending their stomachs. These individuals are notorious for eating and purging in secret. A bulimic will often have secret stashes of forbidden food stashed away throughout their house that they can eat in private and purge quickly. And one of the favorite places for them to hide food is in the bathroom. That's why I showed you a picture of this one. Bulimia actually, I've already done that. Much of the cause of bulimia, is, in particular and eating disorders in general, stems from the perceptions of acceptable appearance for females on television. When television was introduced to Fiji, 3% of the women on the island vomited to stay slender. 3 years later, the percentage of vomiters was 15%. Fashion models maintain a body weight 13 to 19% below that of women they are modeling the clothes for. That's really skinny. That lady right there. While binging and purging may occur millions of times a week around the United States, it is not without its negative effects. Dental complications because of the acid eats away the enamel on your teeth, greater possibility of alcohol abuse, greater possibility of drug abuse, high rate of depression, greater risk of suicide, stomach acid burns to the esophagus and tooth and throat, loss of tooth enamel, as I said before, heart problems such as arrhythmias, menstrual problems, electrolyte imbalances. Binge eating disorder has become an international problem. For the first time in the history of humanity, there are as many people in the world who are overweight as those who are underweight. In the United States, where obesity is defined as more than 30 pounds over one's ideal weight, obesity has increased from 15% in 1980 to 33% in 2005. Binge eating disorder affects 4.6% of the population at large. Binge eating is eating until the individual is uncomfortably full. People tend to be eating in response to emotional states rather than to true hunger signals. These individuals tend to have frequent episodes of eating large quantities of food, feeling a lack of control where food is concerned, eating rapidly and swallowing food without chewing, eating despite being uncomfortably full, eating when not feeling hungry, eating away from others so that they won't see your volume of intake, feeling disgusted because of the lack of control of food, having a preference for high carbohydrate food and foods with high fat content, junk food. Binge and compulsive eaters do not seem to know how to pace themselves, eating rapidly and in massive amounts until they feel painfully uncomfortable. Such eating may be done to control anxiety. Food seems to have a calming and sedating effect on some people. Adolescents who eat when they are depressed are twice as likely to suffer from obesity or bulimia. They are also twice as likely to suffer from anorexia. Compulsive overeaters are more likely to suffer from high blood pressure, high cholesterol, circulatory problems, heart disease, type 2 diabetes. 15 million Americans have type 2 diabetes, sleep apnea, gallbladder disease, gout, arthritis, 15 to 60% greater risk of cancer, exhibit high rates of depression, become distressed, and develop a negative body image, allow their self-esteem to suffer badly. When I was working in medicine, and I worked in medicine for 30 years, but I stopped in 2000. Was the last year that I worked in medicine. We rarely saw gallbladder disease in anybody but middle-aged people. Now we're seeing it in 15, 16, 17-year-olds. I mean, it's just the most amazing thing you've ever seen. We have completely changed what's going on in the United States because of our eating habits. Sexual addiction is marked by sexual behavior that the individual has little control over and little choice. This type of behavior might be practiced by young or old, gay or straight, and male or female. The addiction not only includes sexual contact with another individual, but arousal through masturbation, viewing pornography, serial affairs, phone sex, visits to topless bars, visits to strip shows. Sometimes sexual addiction can involve illegal activity, such as prostitution, sexual harassment, sexual abuse, exhibitionism, and that's what this guy's doing. That's exhibitionism. He doesn't have any clothes on under his coat. Child molestation, rape, and incest. By 2007, there were over 4 million pornographic sites on the internet. 40 million Americans visit these sites regularly. 70% of the visits are during work hours. 10% of the people surfing the porno sites are addicted to online pornography and spend up to 8 hours a day viewing sexual material. Worldwide, the pornography industry clears $57 billion a year. In the United States, the pornographic industry clears $12 billion a year. Much of the pornography is filmed and photographed in San Fernando Valley outside of Los Angeles. When my son was living in the valley, his next door neighbor was a producer of pornographic material. as weird as that may seem. 3 to 6%, and she was a nice lady. She was a really nice lady. She wasn't very old. She was only, I don't know, she was in her late 20s, I guess. 3 to 6% of U.S. population are sex addicts. 80% of sex addicts are male. Sexual addiction usually starts in the teen years and then peaks between ages 20 and 40, after which it slowly declines. Sexual addicts seem to suffer from other addictions in conjunction with their sexual problems. The DSM-5 identifies several paraphilias: exhibitionism, fetishism, voyeurism, pedophilia, sexual masochism, sexual sadism, transvestic fetishism, and voyeurism. Exhibitionism is where you get sexual gratification from displaying your nudity to some other individual. Usually you're seeking shock from that individual. Fetishes, there's lots of different types of fetishes. Fetishes for shoes, fetishes for rubber, fetishes for leather. Voyeurism is where you get sexual gratification from rubbing up against another individual. Pedophilia is sexual gratification from molesting children. Sexual masochism is where you enjoy being hurt. Sexual sadism is where you enjoy hurting other individuals. You get sexual gratification from it. Transvestic fetishism is dressing like the opposite sex and getting sexual gratification from just dressing up like the opposite sex. And voyeurism is what's going on here. He's watching this lady undress. Other sexual addictions include love addiction, the desire to fall in love and be in love; relationship addiction, the need to be in a relationship with an individual. It may mean maintaining multiple relationships at any one time. That's usually what it means, having somebody on the side. If you're only in one relationship at a time, it feels like you're not being fulfilled. Therefore, these individuals always have somebody else. They always have somebody else around. Individuals suffering from any sexual addiction maintain little, if any, control over their behavior despite adverse consequences. The individual will continue to obsess over the behavior to the distraction of everything else. Compulsive sexual behavior is repeated because of the release of the pleasure-inducing neurotransmitters dopamine, enkephalin, and endorphins. Tolerance to these neurotransmitters leads to a need for the addict to spend more and more time in their sexual activity to gain the same mental benefits. Damage can be done to careers, relationships, self-image, and peace of mind. The sexual addiction becomes the driving force in the addict's life. Part of the drive for the addict may be the risk that they are taking to achieve their target behavior. Usually, the addict will culminate the behavior through orgasm, though in some cases it may involve exposure or fondling. The trigger behavior is often followed by remorse, guilt, fear of discovery, resolution to stop the behavior. The sexual behavior is often pursued with a sense of desperation, self-loathing, despair, and low self-image. Doesn't have to orgasm. They're seeking arousal is actually what they're seeking, not especially orgasm. Orgasm is not necessary. Internet addicts seem to have no control over their need to log on. While the internet didn't really begin until 1993, today 4.5 billion people worldwide out of 700 billion people are connected to the internet. 15 to 20% of the 1 billion have high-speed connections. In Canada and the United States, 90% of the population are connected to the internet. The three main uses of the internet are gaming, seeking erotic material, and gambling. The internet is anonymous, it's inexpensive, it's controlled by the user, it's validating, it's rewarding, it's convenient, and it's escapist. Symptoms of internet addiction include logging on at every chance at home or work. Non-addicts log on an average of 8 hours a week. Addicts may log on 40 plus hours a week. Obsessing about the internet, feeling irritable and anxious when not online. Time online increases to make the individual feel they have had enough. Losing track of time when online. Neglecting responsibilities to be online. allowing relationships to deteriorate with spouses, co-workers, family, and friends, posting more messages and downloading more and more data, eating in front of the monitor, checking email frequently more than once a day. And actually, that is very common now since people have their email on their cell phones. Some internet addicts seek oblivion, wanting to zone out, while others seek frequent or constant interaction. Physical symptoms of internet overuse include blurred vision, chronic lack of sleep, twitching mouse fingers, relationship problems. The list of internet addictions includes cybersexual addiction, computer relationship addiction, internet compulsions, information addiction, computer games addiction. Oh, I've become a news junkie over the last couple of years. Maybe I have an internet addiction myself. Computer relationship addiction entails individuals dealing more and more in their online fantasy world. They pull more and more away from their real relationships until they lose them. Eventually, the addict's cyber world replaces and becomes the most important aspect of their lives. For online gamers, the game might start offline, and then as they improve, they need the competition of the online games. Like any other online addiction, gamers lose track of time while they are playing. Some gamers will spend every free moment gaming. Men, teenagers, and children play online more than any other groups. Whereas non-addicts will spend 20 to 60 minutes playing a game, a gamer will average 6 hours a day in their games. I had a student when I was in Montana. He would play all weekend. He'd start Friday night, and he wouldn't end until Sunday morning. And he'd play straight through. And sometimes he would miss his Monday classes because he was in such a good game. He would play 72 hours straight. I mean, it was insane. I thought it was insane. He thought it was normal and natural. And there was something wrong with me because I didn't play games. For the last 60 years, the most frightening non-substance addiction was television addiction. TV addicts may easily spend 6 to 8 hours a day watching. 60% of American homes contain 3 or more televisions. In many American homes, the television is on longer than their lights. The benchmarks for TV addiction: compulsive use making the individual a couch potato, using television to change one's mood, sedative or antidepressant, craving use, loss of control, continued use despite adverse consequences, development of tolerance. The average adolescent watches TV for 1,500 hours a year as compared to only attending school for 900 hours a year. The shows that an addict watches skews how they see reality and leads them to make poor decisions. Since television shows dysfunction as normal, adolescents have a hard time accepting their own culture as real. Commercials for fast food may lead to compulsive fatty food consumption. News focus on negative events leads the individual to skew towards seeing the world as an especially dangerous place. A study in New Zealand showed that the more the child watched television between the ages of 5 to 15, the less likely they were to graduate from high school or go to college. There are over 260 million cell phone users in the United States. There are over 6 billion cell phone users around the world. Calling and texting takes up a large part of a teenager's day, to the exclusion of studying or engaging in face-to-face relationships. And that is finally the end of the chapter. So next week we're still tackling chapter 7. So I'll see you in a couple weeks.